Hi, my name is Dr. Sathish. I am a general and bariatric surgeon, also doing advanced laparoscopic work at Manipal Hospital Yeshwanthpur. I am here today to talk to you about generally the surgical problems that people might encounter, especially in bikers, people who travel long distances, who have biking as an option, especially those who are using two-wheelers driven by fuel. Very commonly it is seen that the bikers usually tend to eat less of fiber and drink less of water. So what happens is generally they would tend to get constipated, and as a result of which bowel movement gets affected and they develop fissures. Fissure is just a cut at the anal opening, and it becomes very painful whenever they attempt to pass stools. The other most common thing that is surgically seen is when there is loss of water, or if they take a food which is outside on the road, they tend to develop dysentery or gastroenteritis. And when they develop gastroenteritis, they might have profuse vomiting, which can cause esophageal tears, and they might even bring out some blood in the vomiters, or they might have plenty of loose stools, as a result of which again they might develop fissures. The other most common thing that is seen usually in the bikers is pain along the adductor region, that is the inner portion of the thigh, and that happens because of long distance driving, wherein the adductor muscle, the inner muscles are pulled into are caused a stretch, as a result of which there is excruciating pain either in the inner segment of the thigh or near the pubic bone. And in the males there can be scrotal injuries, there can be a hematoma, a blood collection within the scrotal wall, there can be chronic testicular pain. In the ladies, they can have vulval edema because of long distance driving. And of course, in both males and females, there is a slight propensity of developing hemorrhoids, again because of faulty bowel movement, which is secondary to inadequate vegetable fiber intake. Now, there is a very remote chance of developing a hernia, which is not a direct relation to the bikers, but say in people who have some abdominal wall weakness, they can develop this hernia on long distance driving. Very isolated reports have been seen. And the other thing is, when they develop a hernia, if they continue to drive, the pain becomes even more worse, and they can land up as an acute emergency in the hospital. Now, apart from this, there are a lot of back issues which can develop as a result of long distance driving, low back pain or lumbago, what we call, and there can also be sciatic pain, which is called as sciatica. There are a lot of people who tend to have their purse within the back pocket and tend to be seated on the bike for a long duration, so they can develop compression of the sciatic nerve and develop some amount of numbness and chronic pain in the backside of the thigh and the calf. So I would like to summarize by saying that long distance bikers or drivers are supposed to keep all these symptoms in their mind and take precautionary measures, such as giving a break in between so that the muscles are not overstretched, trying to consume adequate water and a proper vegetable diet so that they don't develop constipation, and eat healthy food so that they don't develop prolonged diarrhea or gastroenteritis. Now, taking care of all these factors is going to help them continue with their hobby without any health issues. Thank you.